participate in this event by video since you'll be seeing this at about 2 a.m. in my time zone. For the last 3 years, I've been working on access to medicines at the World Health Organization here in Geneva. So as you can imagine, this past year has been quite busy. A lot of my time currently is working on accelerating the development and access for therapeutics to treat COVID-19. And I have colleagues working in tandem on the diagnostics and the therapeutics. This global access is so crucial because with a virus this contagious, no one is safe until everyone is safe. This pandemic has disrupted so many lives, so many plans, not least of which is our reunion. So I'm really grateful for the opportunity to reconnect. Please take care of yourselves, and if you can, take care of someone else as well. Much love, O5. Thank you.
Hi, I'm Lupe Rodriguez, Vice President of Public Affairs for Planned Parenthood Marmonte. At Planned Parenthood, we see firsthand the glaring inequities this pandemic is exposing, as we serve some of the most marginalized communities. In addition to the myriad challenges our patients are facing every day, anti-reproductive healthcare politicians are using the urgency of this crisis to limit access to reproductive healthcare and abortion. This healthcare is essential. This is a time to be expanding access to healthcare, not limiting it, especially vital services like these.
Hi everyone, I'm Brian Smith, class of 2005. Currently I'm an advanced heart failure cardiologist at the University of Chicago. My experience with COVID has been that COVID has sort of unearthed a lot of the inequities that we already know exist that break down along racial and socioeconomic lines, and it's shown us how much work that needs to be done. In Chicago, at one point, 80% of all admitted patients to our hospital with COVID were Black. So it just proves to us that there's so much that still needs to be done in terms of education, advocacy, improving health literacy, improving access to care in the community. And so although we made a lot of progress, I think there's a lot more work needs to be done. Thank you.
Hi everyone, I'm Cami Dixon, also class of 05. I'm an assistant professor of OBGYN at The Ohio State University and the medical director of Moms to Be, which is a community health program working to decrease the infant mortality rate and eliminate health disparities in the city. I've been counseling my patients about COVID-19 since March. We're still learning so much about the virus. We know that the CDC has placed pregnant people in the high-risk group for severe disease. So it's really important to decrease your exposure if possible. So all the same things, wearing a mask, social distancing, avoiding large crowds, washing your hands, these definitely apply during pregnancy. I would say that if you are pregnant, it's really important to reach out to your provider to find out what other restrictions or what restrictions are in place as far as visitation and support during your labor. Luckily here at The Ohio State University, we are allowing our patients to come with one support person, and we most recently in the last few weeks expanded that to include doula care as well. As far as after delivery, we have worked really well with the pediatricians, and if you are COVID positive in our hospital, we're not doing any weird separation of moms and babies or anything, some of the horror stories that I know a lot of my patients were talking about. So we're still trying to adjust to everything, and I'd say that it's just really important still to follow all the social distancing rules to make sure that you are not exposed.
Hi there, I'm Guy Romero. I'm a member of the class of 2005. Just prior to the start of COVID, I moved into my current role as the Chief Medical Officer of about a 500-person not-for-profit hospice in the Bay Area. And my main takeaway from this whole experience has been that if you're trying to protect vulnerable people, and especially if those vulnerable people happen to be people of color, as they so often are, the best way to do that is to put people of color in positions of power. We have a vested interest, and it works. Thank you.
Hi everyone. I want to share a little bit about my experience taking care of patients who've had COVID-19. I see a lot of patients who are diagnosed with a form of cancer and are either coming to see me for complications of their cancer treatment or help in the management of their disease. It's been extraordinary to see how disruptive the disease has been for folks who are particularly battling challenging, often terminal illnesses or diagnoses, and I'm very grateful for all of my colleagues in medicine who've been doing such awesome work to help combat the disease. I've also had family members who have been diagnosed with the disease and are pulling through or have pulled through. So it's been a very challenging year, but I'm optimistic that we are hopefully going to be able to bring things under control with everyone putting in their part.
So COVID for me this year has been a blessing and a curse. Blessing in the sense that the whole world had to slow down in a way to kind of catch up with me still as I continue to battle with cancer. Curse in all of the natural ways that has been a curse to everyone. You have to stay away from everybody and just fearful that, any moment could change your life and potentially end it. So just hopeful as we move forward that we find a cure soon, fast, and that's available to everyone to help us move on from this moment.
Hi, I'm Neil Vossen. I'm a breast medical oncologist at Memorial Sloan Kettering Cancer Center, and I'm also a physician scientist, and I'll be starting my laboratory at Columbia University next year. One of the challenges of being a physician in the time of COVID is really balancing some of these theoretical aspects with the practical aspects of patients living in New York City with cancer. Certainly, we are out of the realm of badness, if you will. Rates in New York are quite low, but we're trying to always balance these recommendations when seeing an individual patient to respecting the fact that they may be on an immunosuppressive therapy, or they may have localized cancer that's curable, but they're living in a small apartment where social distancing may or may not be feasible in its real definition. And so it's really balancing those theoretical and practical aspects that I find challenging, but also quite rewarding with patients.
Hello. This COVID-19 pandemic has certainly changed our way of life. And one of the unfortunate consequences, particularly during the peak of the pandemic, has been delay in routine healthcare as well as emergent care that we've been seeing in the hospital. Speaking as a cardiologist, we've seen delay in patients coming into the emergency room with heart attacks and stroke. And this unfortunately has led to complications due to delays in treatment that could have been prevented with directed timely care. So while it's important to wear masks, to socially distance, it's still important to see your physicians for your routine screening for things like cancer and for coming to the emergency room when you're having symptoms of a heart attack to avoid some of these complications. The hospital itself is designed and equipped to handle routine care, and we're doing everything we can to make sure to keep you, your family, and ourselves safe.
Hey, class of 05, Dreamer Hughes here. Just wanted to make a quick video detailing my experience as an emergency medicine physician in the face of COVID. So about halfway through my pregnancy is when COVID hit, and I work for Kaiser, Georgia, so they were not sure what the effects might be on the unborn fetus, and they sent me home. So great for me, but a little bit challenging professionally because I'm the lead doctor at my equivalent of a standalone ER. So having to gear up my team and get them ready for a potential surge was rather challenging, but we got it done. We did things like forward triage, medical screening tents, cohorting patients, airway pathways. We were ready to go for a surge that never came. We did not see a volume surge like some of my counterparts in New York and other hot areas, but we were ready. So we were ready nonetheless. Instead of a surge, we saw a lull, and now we'll be ready for whatever may come with flu season and a potential surge. So I'm looking forward to hearing from all of you and my colleagues about what we can do just to get ready for potential COVID 2.0.